Hello, everybody, and welcome back to this week's episode of Medisodes, episode 27. Now, I'm sure a lot of you listening probably live in a city where you have pretty quick access to a hospital nearby, but in a lot of parts of the world, access to doctors and medicine is not so simple, and today that's what we're going to be talking about. How people in not so urban areas access healthcare. And to start, Shrey's going to be talking about the geographical challenges involved in getting access to healthcare.
As you would expect, the further away you are from an urban area, the longer it takes to access healthcare. This is because healthcare facilities tend to cluster around urban areas where most of the population is. And this makes sense from an economic standpoint. You can, in the same hospital, reach more patients. So if we look at statistics, 8.9% of the globe's population, which is 646 million people, cannot reach a healthcare facility within 1 hour using what they call motorized transport. And 43.3%, which is 3.16 billion people, cannot reach on foot within an hour. And these are statistics from a study by Nature Medicine. And given that people in rural areas tend to be poorer and probably are less likely to have access to motorized transport, it means that a lot of people have to travel a long way to get healthcare. And this is exacerbated by the fact that countries that are poorer tend to have demographics that skew more towards rural areas. And this makes healthcare in developing countries even more tricky because you don't have the huge urban populations that you can just build one hospital for. You have to really distribute your resources over a large area so that everyone can have access. And this obviously dilutes the healthcare that people can have. A prime example of a country where healthcare is affected by geography is Australia. So obviously Australia has huge urban centres, especially in the southeast of the country, in huge cities such as Sydney and Melbourne, Brisbane, where access to healthcare is pretty easy. It's typical of a big city. In New South Wales, which is the state where Sydney is in, the average time to hospital is 7 minutes by car, and that's using data from Google Maps. However, in the Northern Territory, which is one of the most isolated places on Earth, it's otherwise known as the Outback. This can be the average time to a healthcare facility can be up to 30 minutes. Given the fact that Australia is a highly developed nation with a very good healthcare system, one of the best in the world, this just shows that even the big hitters are struggling to have access to healthcare. Also, on top of that, if you're in a rural location or a very remote location, such as a mountain or something like that, your chance of having more severe injuries is also increased. And this obviously confounds the problem of access, as well as the fact that you need quality medical care. You might have to actually airlift it to a city or a better centre, because even in these rural areas, the existing hospitals, even if they're there, may not have the capacity or the facilities to, say, have an intensive care unit. They may not have one, or they may only have like 1 or 2 intensive care beds. So, for example, many of you will know about Malala Yousafzai, the Nobel Peace Prize winner. She suffered gun wounds from a shooting in Pakistan, and she had to be transported to Birmingham, where they had a specialist care centre for this. So we've talked about how challenging it is to access healthcare in rural areas. Now on to Adrian, who's going to be talking about ambulances, which are a key way to transport patients to hospitals.
The ambulance service plays a unique, singularly important role in healthcare. It's a fundamental part of the emergency services and ambulances are closely connected not only with the NHS in the UK, but also the police and fire services. Where there's an emergency, there may be an injury that requires immediate medical attention. The main purpose of all ambulance services is pre-hospital medical care, although they also transfer patients to the hospital. They are a quick and easy way to access healthcare services, which is important in the case of an emergency. Many large events hire an ambulance and paramedics as part of the programme. If it is deemed that there is a large enough risk of injury, it may prove worthwhile, and so the money is not wasted. The company can also advertise the ambulance as part of its safety features. It is said that it takes 5 minutes from when an ambulance is called to when it arrives at the scene of emergency, but this varies by location. For example, in rural areas, the ambulance dispatch centre is likely to be further apart, and so will likely take longer. Keeping an ambulance at the ready at large or high-risk events reduces the time for an ambulance to arrive, and this is important in keeping the people safe. In the UK, the ambulance service dates back to the 19th century, but this was very different to the ambulance service we have today. This was before the invention and practical popularisation of the automobile by Carl Benz, and so these ambulances were pulled by horses. Initially, these ambulances were locally funded and privately owned, and so could be costly to use. The NHS was formed in 1948, and it was in April 1996 that the London Ambulance Service became a part of the NHS Trust, merged from 9 existing services. The role of ambulance services in the UK have changed greatly since their inception and continue to change over time. It is only in the past that ambulances could be described as a glorified ride to the hospital. Now they provide much more than patient transport, including on-site treatment. Adding resources will never be enough to help the NHS cope with its influx of demand and increase in patients. Another way of helping the NHS cope with such large numbers of patients is changing the way they work, increasing efficiency. A prime example of this is the shift to online consultations for general practitioners, which is a topic that we discussed with a GP in Medisodes episode 25, so be sure to check that one out. The functioning of the ambulance service can also be made to be more efficient, and to reduce the strain on NHS resources. The ambulance service's functioning has changed to make it more efficient, but there is more to be done. The first is delivering a safe reduction in ambulance conveyance, which means that patients are only taken to hospitals if they need it. This involves identifying the initiatives that provide better support for those who have fallen. People who have fallen, especially the elderly, make up a significant proportion of all ambulance call-outs, and may not require hospital treatment, and so taking them to the hospital as a matter of protocol would be a waste of time and resources. Also, increased education amongst those who are prone to falling as to best first steps. Sometimes an ambulance is not necessary, and so calling it would be a waste of time. This means that less people will call ambulances for unnecessary reasons, which frees up resources, and helps more people who need it access the healthcare they need on time. Also, within the same umbrella of reducing ambulance conveyance, it's increasing the training that paramedics have to dealing with a mental health crisis, as well as facilitating access to mental health services and professionals. The NHS can enable paramedics to have immediate access to additional clinical advice, such as having a doctor available to instantly answer the phone from a paramedic at the scene of emergency. This means that they are able to deal with more situations on site without having to take the patient to the hospital. Reducing avoidable ambulance conveyance is a challenge that cannot be achieved by only ambulance services, but also the whole emergency department staff, from the 999 call responder to the paramedics as well. It is also important to reduce handover delays. This is the time between a patient's arrival at a hospital in an ambulance and a clinician coming to see them. Reducing this time increases the efficiency of the ambulance service, because they're waiting for less time with the patient they have already transported, freeing them up for any potential future emergencies. These aims help to improve the efficiency of the NHS, and they form a part of the Lord Carter recommendations, which are a set of goals to help increase the efficiency of hospitals in the UK. This helps to make the most of any additional staff and resources and funding that is put into the NHS, to make sure that they can cope with all the patients that they are getting. Ambulances themselves are very expensive and are well equipped to deal with many different emergencies. The NHS spends on average £8 to answer a 999 call. Dispatching an ambulance to an address costs about £155, and taking a patient to hospital costs over £250. The initial cost of a well-equipped vehicle is as high as £70,000, and on top of this there are costs such as insurance and fuel. The equipment in an ambulance needs to be reliable, space-saving and effective. The most basic piece of equipment is a jump bag, which contains medical supplies such as basic life support and trauma kits. This is usually the first thing paramedics take when they reach the scene of an accident, because of its high versatility to treat several different injuries. The bag contains basic but essential medical items like bandages, drips, medication, and syringes. It is more than a first aid kit though, due to the nature of the scenarios that paramedics are called out to. Most ambulances also carry a big valve mask, shortened as BVM. This is a device that is connected to a mask to provide the patient with ventilation if they are struggling to breathe. These masks are carried in a variety of different sizes, because they are only effective if they fit well around the person's nose and mouth. If breathing difficulties are due to fluid blocking the airways, then a paramedic first has to use a suction tube to carefully remove some of this fluid so that the air can reach their lungs, temporarily of course until they go to the hospital for a full clearance. Ambulances also contain a trauma board, which they use if there is a chance of spinal injury or dislocation. This board helps keep the spine in place while in the ambulance. They may also use a head immobilizer to support the head and neck during transport. A cervical collar is a neck brace that keeps your head and neck in place, minimizing movement and reducing the risk of long-term damage. Unsurprisingly, paramedics also carry a bag of various medications, including anesthetics, IV fluids, anti-seizure medication, adrenaline, salbutamol, and nitroglycerin. These are the essential, basic medications that are being carried to keep the patient safe until they reach the hospital, or wherever it is that they're being transferred. There is also usually an ECG monitor in an ambulance to allow the paramedic to monitor the heart rate of the patient throughout transport. This is especially important if a patient is being taken to hospital with a suspected heart injury, the most common being a heart attack, but atrial fibrillation is common too. The ECG can be used to look for abnormal patterns and monitor the heart rate. If the heart is not beating as normal, the paramedic may use a defibrillator to bring the heart's electrical impulses back to normal. Defibrillators have a much greater success rate than mechanical CPR, so it's important that there is one on board on an ambulance at all times. Depending on the situation, a ventilator may be packed into an ambulance too, but it isn't carried everywhere. It helps push air into the lungs to assist a patient's breathing. This machine can be adjusted to change the rate and depth of breathing, depending on the size and stature of the patient and their current needs. A blood glucose meter or hemoglucometer is also very important in monitoring the status of diabetic patients. Blood glucose levels need to be regulated to keep the patient safe, and the paramedic can prescribe certain medications based on this level, but it has to be monitored regularly. The final largest item is a wheeled cot, which is used to move patients from the scene if they are unable to walk themselves. There are also other miscellaneous items that are carried in an ambulance, including thermometers, blood pressure gauges, tapes, flashlights, blankets, plasters, and so on, to make sure paramedics are prepared for any situation. So ambulances play a crucial role in immediate healthcare. They aim to deliver immediate response within 5 minutes, but of course that depends on location, how far you are from the dispatch unit. And if you're in more rural areas, the population is likely to be more spread out, and so the dispatch location is likely to be further. And of course, some ambulances aren't able to reach their site quite fast enough. And a relatively modern introduction is air ambulances, for which we're moving on to Surya.
In the UK, there are 44 air ambulances. England has 33, Scotland has 3, Wales have 4, and Northern Ireland have 2. These 44 air ambulances consist of only 7 types of different helicopters that are used to serve about 66 million people. Considering this, it is quite fascinating that an emergency can be reached by an air ambulance in 10 to 20 minutes after a call out, regardless of where the emergency is in the UK. Regions with a high population have their own air ambulance, such as London. All of these air ambulances are operated by air ambulance charities. So let's just look at the air ambulances in all 4 regions of the UK in more detail. As England has a higher population than any other region in the UK, it makes sense that England has the highest proportion of air ambulances in the UK as well, with the 33 air ambulances covering over 48 counties and 55 million people. Looking at Wales, 4 air ambulances cover 8 counties and over 3 million people. It is also important to note that air ambulances which serve in Wales do not cross over to England unless there is a national emergency. So far, we have seen the number of air ambulances in each region is directly proportional to the relative population of the region. That is, a higher population means that there are more air ambulances in the region. However, Scotland has a population of over 5 million people, but still has one less air ambulance than Wales, who have a lower population than Scotland. This is because the concentration of the Scottish population is in a relatively small area, whereas the population of Wales is more spread out. The Scottish air ambulances operate out of busy city heliport hubs and even out of Glasgow Airport. Looking at Northern Ireland, there are 2 air ambulances, which serve 6 counties with a total population of roughly 1.8 million people. The Northern Irish population is concentrated in a much smaller area when compared to any other region in the UK, helping us to explain why there are only 2 air ambulances in operation. Taking a step back to consider the UK as a whole, we saw that there were only 7 helicopter models being used. Of these 7 models, 3 are different Airbus models. The Airbus models make up more than 60% of the air ambulances in the UK. Looking at the operators of these air ambulances, there are 23 charities that operate the 44 air ambulances in the UK. Now let's look at some stats behind how air ambulances have worked to help people with acute health conditions. Air ambulance charities usually publish data about their work under the name of mission stats. Looking at the mission stats for London's air ambulance in 2019, they have managed to bring their trauma team to over 1,730 patients, an increase of 74 compared to last year. Of these 1,730 patients, 1/3 were from stabbings and shootings, 28% were from road accidents, and 1/5 were from falls from large heights. Scotland's charity air ambulance have published their mission stats for 2020, which they have responded to 460 call-outs, 17% of which were medical cases, 18% had cardiac issues, 5% were stroke patients, and 47% were in trauma. From these stats, it is clear that air ambulances have a significant impact on helping patients with acute medical problems. So hopefully this has given you a brief insight into how air ambulances work. Now let's move on to Anupam, who will be looking at providing healthcare in remote environments.
So far we've covered healthcare in pretty remote environments and the ways people access them. But the 3 examples I'm going to talk about now are some of the most inhospitable places on Earth, and some not even on Earth. In Australia, the outback is a vast, sparsely populated, semi-arid desert where there is no population or life for many hundreds of kilometers in most cases. So how do people living in the outback, working on the cattle farms of Australia, for example, get access to healthcare? For that, we have to talk about RFDS founder Reverend John Flynn. The Reverend had worked in rural and remote areas of Victoria and was commissioned by the Presbyterian Church at the time to look at the needs of outback people. He had witnessed the daily struggle of these pioneers living in remote areas and had a vision to provide a mantle of safety for the people in the bush. The flying doctor service he founded paved the way for healthcare to be delivered to these people rapidly and efficiently. At first, it lacked the communication technology needed to deliver services efficiently, but they helped hurdle this barrier by 2 main key developments: flight and radio. The invention of a pedal-operated generator and the new development of flight in the early 20th century helped healthcare professionals get to the scene of accidents much faster than any other method at the time. Currently, the RFDS operates 77 planes and is growing in size every year, with 4 different planes that are used in aeromedical operations. These are the Pilatus PC-12 and PC-24, the King Air B350C, and B200C. Each of these planes is outfitted with a custom cabin, set up with 2 stretcher beds, 3 seats, and this can be set up in a variety of configurations. The front door allows the flight to conduct his pre-flight inspections and enter the plane without disturbing the medical crew and patients in the rear. The equipment on board include transport ventilators, critical care monitors, infusion devices, point-of-care testing kits, portable diagnostic ultrasound equipment, and a range of other splints and devices needed for all sorts of incidents they could respond to. More notably, the PC-12, PC-24, and King Air are pressurized and so can be used to safely transport patients who would not otherwise tolerate the decreased atmospheric pressures involved in non-pressurized aircraft. The internal cabin pressure can be maintained throughout the flight as the same as that at sea level, which is important for patients critically sensitive to pressure changes. In addition, this allows the aircraft to fly at a sufficiently high altitude to avoid turbulent weather conditions. The cockpit of the planes is also specially designed for single pilot operations in all weather conditions, day and night. The instrumentation includes state-of-the-art enhanced ground proximity warning radar and aircraft advisory systems, including GPS, as well as the standard equipment in most small planes. The staff is also very important. Flight nurse is usually on every flight, and in cases where the patient is seriously ill, a doctor is present. In most cases, the pilots will also have medical degrees or medical training. Other passengers can also be facilitated, including accompanying relatives or specialist medical staff when needed. This system, which now serves the whole of Australia, is the largest flying doctor service in the world and has proved effective for many, many years now, having saved hundreds of thousands of lives across the country. But what if we were to go somewhere even more remote? Antarctica is probably the most inhospitable continent on the planet, with freezing cold temperatures and no help for literal miles around, with the whole continent itself having no permanent residents. However, in McMurdo Station, one of the most desolate places on Earth, there are about 1,000 residents who live there and call the Antarctic Research Station home. How do they get their healthcare? Well, the station itself has 2 civilian doctors, a full-time pharmacist, and also a dental technician. Most of these people don't work there with full salaries. In fact, many of them will have much worse pay than if they would take their same jobs back in the United States. However, these are the only sources of medical care that a lot of the scientists and researchers working at the station have. For example, and even then, the station has very limited access to healthcare. For example, when dealing with mass casualties, all of the personnel that serve at the base have to volunteer to serve as blood donors, and the doctors working on site would have to type all the recipients and donors to make sure that blood is given correctly. Of course, they make it very clear that their job is not to fix everybody. Their job is to make sure they're fixed up enough so that they can get back on a plane to places such as New Zealand, which is the closest place, even though that itself is many hundreds of miles away. But what if we would go somewhere where even a plane journey is out of the question for trying to treat someone? In 1961, the newly created NASA started Project Mercury in an attempt to win the space race against the USSR, and one key problem they ran into was how to deliver healthcare when your astronauts are literally hundreds of miles above your head. Project Mercury employed very rudimentary medical kits using auto-injector needles, syringes designed to deliver just a single dose of medicine. And in the first 4 missions, the available drugs were extremely limited. Some anti-motion sickness medication, a stimulant, a vasoconstrictor for treatment of shock, and an analgesic. That was all that was available to those astronauts. Later, during the Apollo program, priorities shifted to ensure the return of crew safely back to Earth, and therefore to identify, eliminate, or minimize health hazards. For the first time, for example, the Apollo crews were video monitored from ground, and biosensors were able to measure their oxygen consumption and CO2 levels. All the astronauts also received medical training to help them recognize any abnormalities in their health status and understand the effects of spaceflight on their bodies. Another problem faced by the astronauts was pressure related in terms of the packaging of medicine. This issue was solved at first by puncturing each unit dose medication cell with a small pin, restoring the pressure equalization. Later, these spray bottles were eliminated in favor of dropper models. However, the dropper models also proved inappropriate in microgravity conditions, and since the space shuttle era, spray bottles have been reintroduced into medical kits as the way of delivering medication. And with the advent of the space shuttle era, each mission finally saw trained physicians or medics on board, and therefore an expanded medical capability. They also had formalized medical kits, Before then, it was put together differently for each mission, but now the Shuttle Orbiter Medical System, or SOMS, was able to support medical care for minor illnesses and injuries for 7 crew members from 1 to 2 weeks, but also provide devices to stabilize severely injured members until their return to Earth. Now, currently on the ISS, there's never been a major medical emergency, but what would happen if it did? First off, all the crew members have been trained to have life-saving skills, including how to stitch a wound, give injections, and how to even extract teeth. According to NASA, this training is aiming to prepare their astronauts, and the Russian astronauts likewise, for the most common medical problems faced on the ISS: motion sickness, headaches, back pain, skin conditions, burns, and dental emergencies. The ISS also maintains 2 separate medical kits, one in the Russian segment and the other in the US. The US is directly derived from the SOMS kit of earlier generations, but has been greatly augmented, having now 190 medicaments labeled in both English and Russian. This kit, however, is still quite basic. It contains a first aid kit, a book of medical conditions, and some useful medical equipment, including a defibrillator, a portable ultrasound, a device for looking into the eye, and 2 liters of saline. However, lacks a lot of other things that a proper medical station would need. The designated medical officer is also trained specially to deal with emergency resuscitations and also how to contact the flight crew on the ground. How to contact the flight surgeon on the ground in case of need. And although their lightweight ultrasound device can generate clear pictures of the inside of the human body, they have to relay them to a medical team back on Earth for proper diagnosis, and there would be no means of fixing the problems on the ISS. All in all, the medical problems faced by humans in remote areas are ever increasing, but thanks to new developments in technology, innovations in systems and organizations for carrying out medical care in these areas, and much, much more, we are slowly making medical care available in more areas and making sure that people can get the help they need when needed. Thank you for listening to this week's episode, and like, comment, and subscribe on the video, and make sure to share this video with anyone you think would be interested. Thank you for watching, and see you next week with another video.